Good morning. We are the Group 4 from 2BSN A1-2, and we will be defending for our research proposal, Student Nurses' Knowledge on Reproductive Health. So for rationale, reproductive health knowledge is vital in the growth and development of the adolescents. However, research have shown that there's a low reproductive health among the adolescents. So these problems affect the nurses for maximizing the giving opportunities for the adolescents to develop their sexual and reproductive health. And also, nurses deliver the nursing education. In order for this, they need to gain knowledge on sexual and reproductive health to advance their skills. And this skills and knowledge is created to create a positive outcome on the adolescent sexual and reproductive health. So since there are no specific studies on the knowledge of nursing students on reproductive health, our research intends to examine the reproductive health knowledge of nursing students in Finma Aurelio University.
Statement of the problem. 1. Profile of the participants, age and sex. 2. How knowledgeable are the nursing students of FINMA AU concerning reproductive health knowledge in terms of the following aspects? 2.1 Reproductive, 2.2 Contraceptive, 2.3 Sexually transmitted disease, and 2.4 HIV and AIDS. 3. What recommendation can be formulated based on the result of the study?
So for our theoretical framework, we have two. First is the theory of the information, motivation, and behavioral skills. So there are three factors related to risky behavior. This model is created for the purpose of predicting HIV preventive behavior and also the essential elements of HIV prevention. So the first factor is the knowledge or the awareness of the individual, the motivation of the individual to abstain from those who are infected with HIV, and third is their personal level of understanding about the risk of being infected of HIV. So linking this in our study, HIV knowledge is one of the focuses of our study. So if there is a great knowledge about HIV and reproductive health, then the individual will abstain from those who are infected and understand the risk of being infected. Second theory is the theory of reasoned action and planned behavior. So an individual's health behavior is dictated by their expectation to play out a behavior. It is anticipated by their attitude toward the behavior and subjective norms regarding the behavior. So an individual's behavior is somehow correlated in our study by understanding its control of behavior in their environment. So linking this in our study, the student nurse attitude and subjective norms can be a way of determining their awareness of reproductive health. So for our conceptual framework, we have the input process output. First is the input, which is the questionnaire by FHI 360. FHI 360 is an organization that has long managed projects relating to family planning and reproductive health. So the questionnaire that we will be using is entitled A Guide to Monitoring and Evaluating Adolescent Reproductive Health Programs. So we are focused on the reproduction, contraceptive, STD, HIV, and AIDS. So for our research approach, we have quantitative descriptive research. We will be using quantitative data and describing it to make inferences about the research. For our research design, we have survey research design with the use of purposive sampling method where we pick out the student nurses from Finma Aurelio University. And our research instrument is the questionnaire by the FHI 360. And for our analysis of data, we are going to use statistical measures, which is the descriptive statistics to describe what is being inferred by the data. So for output, we will have identified knowledge of nursing students on reproductive health and its implications and recommendations.
Significance of the study, nursing student, it helps us to expand or become aware to our reproductive health, and it also helps us to apply it on our profession. Nursing education. They train student nurses to take care the health of our patients. Nursing research. It guides us to change what we know about our topic, and it also provides other details to conduct research properly. The assumptions that were formulated by the research team are as follows. 1. Student nurses are aware of reproductive health regarding reproduction, contraceptive, sexually transmitted disease, and HIV and AIDS.
Scope of the study. The study will cover the knowledge of nursing students of Pinma Aurelio University from year level 1 to 3 regarding the reproductive health. The research will be conducted through online surveys from the questionnaires of FHI 360 on the reproductive health knowledge. For the delimitations, the study will not include other courses, thus it only aims to assess the knowledge of the nursing students. The study will not include the other parts of the reproductive health because it only focused in the reproduction, contraception, and sexually transmitted diseases. For the limitations on ensuring sample and collecting accuracy are resolved or fixed by giving the respondents sufficient time to respond to the surveys. Limitations on the computer literacy are also fixed by means of giving the respondents accessible and simple surveys. For the definition of terms, the researchers have only decided to present only the significant terms from the topic. First is the reproductive health. It is the main topic of the study. This defines or to assess the knowledge of the nursing students regarding the reproductive health. Reproductive health knowledge used by or how the nursing students is aware from the reproductive health.
So for our review of related literature, we have Pastuzak et al. 2016. The research results that the participants lack sexual and reproductive health knowledge, and they are not aware that they are engaging in a very risky sexual behavior, and that young males had a low engagement and lack of knowledge of testicular health practices. Another literature from de Labregue et al. 2013 that their respondents of their study were found to possess some misconceptions regarding HIV, AIDS, and STIs. And also according to Rodriguez et al. 2015, he granted that men have inadequate information about the HIV prevention strategies, and according to Wills 2014, that nurses are in a perfect privileged position to deliver reproductive health promotion as they are transparent and recognizable. And it is crucial aspect of a nurse role to provide a comprehensive assessment needs of the patient, and this includes the sexual health. And there's an evidence that student nurses determine the importance of learning sexual health during their undergraduate training, according to Bretas et al. 28.
Research design. The study is a quantitative survey descriptive method where the researcher gathers important data from the respondents. Quantitative methods emphasize objective measurements of data collected by means of computational techniques. The collection of data will be conducted when the questionnaires are being sent through online surveys.
Local of the study. The study will be conducted at Pinma Aurelio University located at Barangay Bitas, Cabanatuan City, Nueva Ecija. The respondents are currently enrolled at Pinma Aurelio University under the Department of College of Allied Health Sciences.
Here in our source of data we gathered from our respondents' response from Pinma Aurelio University and College of Allied Health Sciences Department using questionnaire made by FHI 360, which sampling type and technique of our study. Our respondents in this study are nursing students. We applied purposive sampling, non-probability sampling, and convenience sampling in our study. So first is the purposive sampling, which is to select particular characteristic of members that are of interest which best enable to answer our research questions. Convenience sampling also applied wherein choosing student nurses that are readily available to participate.
So for our methodology, the research instrument, we will be using questionnaire that is validated by the phase validity. With phase validity, we are going to give the questionnaires to professors and to the panelists who understand our research topic, and they will be evaluating whether the questions effectively capture the topic under research and check for double and confusing questions. Second step is to conduct a pilot test of the survey on the subset of the research sample, and after collecting the data from the pilot test, we will be entering the data into spreadsheets to check if the questions are answered correctly and check for inconsistency. And the fourth step is to use the principal component analysis with the help of an expert. So it will be used to identify what factors the questions measure. The fifth step is to check the internal consistency of the questions using the Cronbach's alpha. So this will be used to determine the correlation of the questions and the consistency of the responses. So the final step is to revise the questionnaire based on the information from the PCA and CA.
Data gathering procedure. Any data collection protocol will be first approved for the data gathering procedure. A letter will be first submitted to the dean, the college's head, and after obtaining and submitting the permit needed, the researcher will ask the consent of the respondents if they are willing to participate in answering the research questionnaire. The researcher will send a link, an online survey using the Google form for the nursing student of Pinma Aurelio University. The respondent's information will be kept by the researcher with confidentiality and will be certain that there is no leakage in the personal information. Tool of data analysis. In analyzing the respondent's knowledge on reproductive health, the researcher used frequency and percentage tools. The percentage describe a part of the whole. The formula is frequency counts divided by number of the participants times 100%.
Protection of rights. These are the observed activities and events by which the different rights of the subject are performed. First is the right to confidentiality. It is where the researchers must own the responsibility of confidentiality. The second one is the right to information. It is where the respondents are entitled to information about unintended findings about their health. The last one is the right to anonymity. This is a vital component in protecting both right to freedom of expression and right to privacy.